Domperidone, sold under the brand name Motilium among others, is a dopamine antagonist medication used to treat nausea and vomiting and certain gastrointestinal problems like gastroparesis or delayed gastric emptying. It raises the level of prolactin in the human body and is used off-label to induce and promote breast milk production. It may be taken by mouth or rectally. Side effects may include headache, anxiety, dry mouth, abdominal cramps, diarrhea, and elevated prolactin levels. Secondary to increased prolactin levels, breast changes, milk outflow, menstrual irregularities, and hypogonadism can occur. Domperidone may also cause QT prolongation and has rarely been associated with serious cardiac complications such as sudden cardiac death. However, the risks are small and occur more with high doses. Domperidone acts as a peripherally selective antagonist of the dopamine D2 and D3 receptors. Due to its low entry into the brain, the side effects of domperidone are different from those of other dopamine receptor antagonists like metoclopramide, and it produces little in the way of central nervous system adverse effects. However, domperidone can nonetheless increase prolactin levels, as the pituitary gland is outside of the blood-brain barrier. Medical uses include treatment for nausea and vomiting where there is some evidence of its antiemetic activity. It is recommended by the Canadian Headache Society for treatment of nausea associated with acute migraine. For gastroparesis, a condition characterized by delayed emptying of the stomach, domperidone can be used to increase the transit of food through the stomach by increasing gastrointestinal peristalsis. It may be useful in idiopathic and diabetic gastroparesis, although increased rate of gastric emptying induced by drugs like domperidone does not always correlate well with relief of symptoms. Domperidone is used off-label in some countries to stimulate lactation or enhance breast milk production, but it is not approved for that purpose in any country, and is not approved for use in humans in the United States. It acts as a peripheral dopamine antagonist, and is hypothesized to stimulate prolactin secretion. In Parkinson's disease, domperidone can be used to relieve nausea and gastrointestinal symptoms. It blocks peripheral D2 receptors, but minimally crosses the blood-brain barrier in normal doses, so has no effect on the extrapyramidal symptoms of the disease. It may also be useful in the treatment of orthostatic hypotension caused by dopaminergic therapy in people with Parkinson's disease. Domperidone may be used in functional dyspepsia in both adults and children, and has been found effective in the treatment of reflux in children. However, some specialists consider its risks prohibitory of the treatment of infantile reflux. Due to the blockade of D2 receptors in the central nervous system, D2 receptor antagonists like metoclopramide and antipsychotics can produce a variety of additional side effects, but this is not the case with domperidone because it minimally crosses the blood-brain barrier. However, at higher doses it might produce side effects similar to those of centrally permeable D2 receptor antagonists. Domperidone causes hyperprolactinemia due to D2 receptor blockade, which can suppress the secretion of gonadotropin-releasing hormone from the hypothalamus, resulting in hypogonadism and low levels of sex hormones. Females may experience breast enlargement, breast pain, excessive milk production, and cessation of menstrual cycles. Males may experience low libido, erectile dysfunction, and impaired spermatogenesis. Domperidone use is associated with an increased risk of sudden cardiac death, most likely through its prolonging effect of the cardiac QT interval and ventricular arrhythmias. The risks are dose-dependent and appear to be greatest with high doses via intravenous administration and in the elderly.